Good evening all. Today our class is about Latissimus dorsi. This is one of the important question for 5 marks. Our class is about Latissimus dorsi muscle. See, watch the video completely, share to your friends and follow us in Instagram for notes. Okay, then now we will start our class Latissimus dorsi. And Latissimus dorsi, it is the only muscle which connects the pelvic girdle to vertebral column to the upper limb. Okay, that means it is the only muscle that connects from this is the pelvic region, this is the pelvic bone, and it connects the pelvic bone to the vertebral column and then vertebral column to the bones present in upper limb. Okay, it is the only bone that connects the pelvic girdle to the vertebral column and then to the bones of upper limb. This is the special peculiar feature of these Latissimus dorsi. And then we comes to the origin. See, I already told in the last class, while studying about the muscle, we should know the origin, insertion, nerve supply and action of that muscle. Only these 4 points. These 4 points included in 5 marks along with the diagram. Okay, then comes to the origin. First, the origin of Latissimus dorsi takes place at posterior 1/3 of outer lip of iliac crest. That means it is the outer side of iliac crest, and at the posterior, that means this is anterior surface and this is the posterior surface. While we are and this diagram belongs to posterior surface of the bone, posterior surface of the body. Okay, and Latissimus dorsi muscle also belongs to posterior muscle, that means back muscle. This is the posterior surface of the iliac crest, and origin takes place at lateral, outer surface. That means here outer side of 1/3, posterior 1/3 of outer side of iliac crest, then to the posterior layer of lumbar fascia, and then to the posterior region of lumbar fascia. That means here after thoracic vertebrae we are having lumbar vertebrae here, and it continues with the lumbar vertebrae here. This is lumbar fascia, and then to the spines of T7 to T11. That means here, from here to here, it continues from iliac crest to the lumbar fascia, and then to the T7 to T12. That means 7th thoracic vertebrae to 12th thoracic vertebrae, and then to the lower 4 ribs. That means 12, 11, 10 and 9. 9, 10, 11 and 12 ribs. Okay, I will write aside here 9, 10, 11 and 12 ribs. I repeat again, the origin takes place from the iliac crest to the lumbar fascia, and then to the thoracic 7th to 12th vertebrae, and then to the lower 4 ribs, and then to the lower inferior angle of scapula. That means here is the scapula, it is the spine, acromion process, coronal process, here is the scapula, and this is inferior angle. I already told about inferior angle in the scapula while studying about scapula. Okay, and it origin takes place at this inferior angle also. That means this is one of the largest bone. That means here it attaches from the iliac region to the lumbar fascia, and then to the thoracic region, and to the last 4 vertebrae ribs, and then to the inferior angle of scapula. This is all about the origin of this muscle. Okay, origin takes place at 4 sides. That means iliac crest, then to the lumbar fascia and the thoracic vertebrae, and then last 4 ribs, and then to the inferior angle of scapula. Origin is completed. Now comes to the insertion. Insertion is very simple. That means the muscle comes from here like this, right? Okay, the insertion, this muscle insertion takes place at only one place. That means here at upper side, see any minor muscle present at the upside and major muscle present at lower side. That means teres major present at upside, and then teres minor present at upside, teres major present at lower side. Okay, now this insertion takes place at lower border of teres major. That means if it is the teres major muscle, the insertion takes place at this lower border. The insertion takes place at the lower border of teres major muscle. That's it about insertion. Only one point regarding the insertion. Next comes to the nerve supply. Nerve supply is from C6 to C8. C6 to C8. That is thoraco dorsal nerve. Thoracodorsal nerve. Okay, from C6 to C8. This is about nerve supply. And then comes to the action. See, action, it helps in the adduction, extension and medial rotation of shoulder. Okay, adduction, extension, medial rotation of shoulder. First action or function, and next action is helps in violent expiration. That means if we expire the air from lungs very forcefully, that means during cough or sneezing or some voluntary conditions, etc., etc. Okay, in these conditions, these muscle helps very prominent role, plays very prominent role at that conditions. Okay, the helps in violent expiration. This is the second function or action. Next, third one is essentially a climbing muscle. This latissimus dorsi is also called as climbing muscle because while climbing to the upside on a tree, either on tree or on a house or anywhere, while we are climbing upside, this latissimus dorsi is the major muscle for this function. So it helps in climbing. It is also called as climbing muscle. And the last function is holds inferior angle of scapula in place. That means, see, scapula, there is a more support for the inferior angle of scapula, and here is the inferior angle of scapula. Here there is no major support for this inferior angle of scapula. So this latissimus dorsi holds the inferior angle of scapula in a particular place. This is the function of this muscle. So we have completed the origin, insertion, nerve supply and action of this muscle. Thank you all. Notes available in Instagram, and this is our notes. It is important for 5 marks question. Thank you all.